Okay, so we're about to start. We're going to talk this afternoon about diabetes, and we know that diabetes is one of those conditions that is plaguing our society today. But really and truly, it does not have to do that. It does not have to be plaguing our society. And so we're going to learn a little bit about diabetes and how we can prevent it if we don't have it, and how we can control it if we already have it. All right? All right? And so we're going to talk this afternoon about diabetes and how it affects our health and what we can do to combat that. So our objectives are that we talk about what diabetes is, the role of insulin, identify risk factors for diabetes, list some symptoms of high blood sugar, and then we'll talk about how you take care of diabetes. Now, this slide gives us some information as to the status of diabetes here in Trinidad. All right? And according to the International Diabetes Federation, where this slide is from, 1 in every 7 adults in Trinidad have diabetes. 1 in 7 adults. So when you count 1, 2, 3, 4, 5, 6, 7, one of you have diabetes. All right, that is how the situation is here in Guyana. In Trinidad. So on average, based on the report, we have a little over 140,000 persons in Trinidad with diabetes. What is even worse is that close to 40,000 people in Trinidad does not even know they have diabetes. All right, so they're going around the place feeling good and everything else, but they have diabetes. All right? Money spent on diabetes. In 2015, the government of Trinidad spent $1,263 for every person with diabetes. So you multiply that 1,263 by 7 or 8 or 9, and then you multiply it by 140,000. And then you have an idea the amount of money spent just for people with diabetes. All right? I'm sure we can use that money for other things that will benefit us better. So, the question then is, what is diabetes? Anybody want to tell me what you think diabetes is? Too much sugar in the blood. All right? Too much sugar. Anything else? Does diabetes mean you can't eat anything anymore? All right. No. Most people, when you hear diabetes, the next thing that comes to mind is sugar. All right? The question, therefore, is, do we need sugar? Do we need sugar? Yes. But why do we need sugar? For energy, yes. So if we need sugar for energy, how is it that sugar is the problem with diabetes? That don't add up. Does it add up to you? If we say that sugar is the problem for diabetes, but we still need sugar for energy, that doesn't add up. So therefore, the problem with diabetes is not a sugar problem, but it is what we call an insulin problem. Insulin is a hormone in our body that is responsible for taking care of the sugar when we take it into our bodies. All right? So either the body does not make enough insulin, or the body doesn't use the insulin effectively. So, what is insulin? It's a hormone made by the cells in the pancreas. All right? A pancreas is an organ in our body that is responsible for producing insulin among other things. So it produces insulin, and insulin works as a key to open the doors of the cells. So what happens is that when we eat our food, the carbohydrates in the food turns to sugar. The carbohydrates in your food turns to sugar. So let's stop and identify these foods that turn to sugar in our body. Remember we said we have to have sugar. We agree with that? That we need to have sugar. So let's look at the food that we eat that turns to sugar. Let me hear you. What are carbohydrate foods? Rice, flour, cassava, macaroni. What else? Sugar, yeah, sugar. Yeah. Ice cream. Yes. Cake. Yes, yes. We having them. Any more? That's all? No, man, that's not all. Mango. Yeah, a mango. And your oranges. Your watermelon. Yes. Your coconut water. Yeah. Yes, your coconut water. Your oats. Yes, your oats. Yes. Your cereals. Your provisions, your banana, green or ripe, your sweet potato, right? All of these things, turn to sugar in your body, all right? Now, I hear somebody ask, what are we going to eat? But did we say that we need to have sugar? Yes, right. So we need to have sugar, and these are the things that put sugar in our bodies. All right? Now, when the sugar enters our body, or when we eat, it goes to our stomach, turns into sugar. So it turns into sugar, and then it leaves the stomach and goes to the liver. The liver now is responsible for distributing the sugar around the body. There are three places sugar go in our body. The first place is that the liver keeps some for itself. Now, they tell you, the old people say that when you get your salary, you must put up some for the hard time, or they don't tell you that in Trinidad. Oh, yes, they tell you that in Trinidad as well. Right, so the liver knows that as well. So the liver decides to keep some of the sugar, because remember we saying the sugar is for energy. So the liver realizes that there are some times when the energy would go low, and so it will have to use some. So he keeps some energy for some of the sugar for itself. The second place that sugar goes is to our muscles. So that is why we encourage you to exercise. When you exercise and move those muscles, you basically are using up the sugar that goes to the muscles. And guess what? You don't need any insulin for that sugar to break down in the muscles. So we encourage you to exercise, because some sugar goes to the muscle to make energy there. By the way, what do you think happens to that sugar if we don't exercise that goes to the muscle? Anybody can guess what happens to it? It's spoiled, yeah, but when it's spoiled, what it become? Yes, it's spoiled indeed, and it turns to fat. It turns to fat. Yeah. All right, it turns to fat. Now, the third place that sugar goes, which most of the sugar would go, is to the cells of our body. It is inside of the cells that energy is manufactured. All right, so the sugar has to go into the cell, and the cell would use sugar to make energy, and that is how we get enough energy to run and walk and do our housework and things like that. All right, now the problem is that sugar can't just walk into the cells. It needs a key to open the door of the cell so that it can get in. Anybody can guess what that key is? Insulin. Insulin is that key that opens the door to the cell so that sugar can get in. The problem with diabetes is either there's not enough keys to open the door or the keyhole is blocked up. All right, you might have the right key, but somebody pushed something in the keyhole, you still can't open it. All right, so one of those two things is happening when somebody has diabetes, or both of them. Either there's not enough insulin being produced by the pancreas, or the keyhole is blocked up. Can you guess what the keyhole will be blocked up with? Fat, yeah. Fat is what it is blocked up with. So that is the problem with diabetes. So the next question then is, why do you think people develop diabetes? Anybody? Why do you think people develop diabetes? How do they allow it to block up the cell? What is it that people, how do people, too much carbohydrates, all right? Any other reason why people develop diabetes? Stress, all right, Any other reason? Lack of exercising, Any other? What if I told you, look at that. Too much fried chicken? Look at that. You see what is written there? No one knows why persons develop diabetes. Do you know anybody that eat from rope to soap and everything in between and they don't have diabetes? Yes. So how is it that those things cause diabetes? You know anybody that is lazy, they sit down whole day, big and fat, and they still don't have diabetes? Yes. So we really can't say what caused diabetes. However, we can say that there are some risk factors, some things that make it more likely for us to have diabetes. And it's important that we understand that, because you might say, oh, I'm getting up every morning, exercise, I'm making sure I eat correctly, and yet still I get diabetes. But that is because we don't know exactly what caused it. But when we do those things, we're basically minimizing the risk of developing diabetes. So let's look at some of these risk factors that put us, that make it likely for us to develop diabetes. Things like getting older, being less active, being heavier, right? Overweight, all right? Diabetes run in the family, genetics, all right? Some people may have mother or father with diabetes, a brother or sister with diabetes. It makes it more likely for you to have diabetes. But the thing is, as we go through these risk factors, I want you to pay attention to them and try to identify what you can relate to, all right? So we started talking about getting older, we talked about less active, being overweight, diabetes in your family, and the more risk factors you have, the more at risk you are, all right? We're looking at some more risk factors. Ethnicity, all right? And you notice there that every one of us here in Trinidad fall under one of those ethnic groups that are at risk for. So there are some of these factors that you have no control of. We can't say that, oh, I don't want to be born in this kind of family. Anybody can make that decision, oh, where you want to be born? No, but there are some that we have some control over, all right? Age is another. I mentioned age earlier, but from the time you're 40 years old, you become at risk right away there, just by getting older, all right? Can anybody say, oh, I'm not going to I'm not going to reach 40. I'm going to stay at 30 years old for the rest of my life. Anybody can say that? No, we have no control over that. Women that give birth to children 9 pounds and over, both the mother and the child is at risk for diabetes. All right? Women that have diabetes only during the pregnancy, gestational diabetes, you are at risk for diabetes later on. And so it's important that we understand these things so that we can put measures in place to delay or prevent diabetes. So you might say, oh, I only have diabetes when I'm pregnant, and then it goes away. It doesn't really go away. It don't go away unless you put measures in place to make sure that it goes away. All right? We talked about being inactive. Exercising less than 3 times a week put us at risk. Somebody mentioned stress before. All right? And stress can be seen from 2 perspectives. Stress could be your worries and your problems and your bills and rent and those things that the husband and wife that give you a problem, and the daughter and son giving you a problem. But stress can also be related to what is happening internally. So you might be sick, you might have arthritis, all right? And that arthritis is causing a lot of pain. That pain is a stress to the body. And we're saying that these things add up to contributing to you developing diabetes. All right, we continue to look at some other risk factors. Now, these risk factors are what lead to the keyhole being blocked up. The keyhole being blocked up. You ever hear women talk about polycystic ovaries? Yeah, women with polycystic ovaries are at risk for developing insulin resistance, which is where the keyhole is blocked up. All right, and insulin resistance will eventually lead to diabetes. Anybody ever heard of, see that other word there? Acanthosis nigricans? You never hear that. All right. You never hear the word, but I know you have seen it already. And so I will show you what it is shortly. So acanthosis nigricans leads to insulin resistance as well. Then there's metabolic syndrome. Now, metabolic syndrome, whenever we talk about syndrome, we're talking about a number of things occurring one time in the body. And this is what occurs with metabolic syndrome. You go to the doctor and they take some blood tests. One of those blood tests is for fats. One type of fat in the body is the triglycerides. If that triglycerides is over 150, you have ingredient number 1 for metabolic syndrome. Then you hear about the good and bad cholesterol. Anybody hear about that? Yes. All right. So the good cholesterol, well, they're not really good and bad, but we just say good and bad to help you to understand a little bit more. So the one we call good cholesterol, if it's less than 50 in women, less than 40 in men, it means that you have ingredient number 2 for metabolic syndrome. If your blood pressure is high, that is another ingredient for metabolic syndrome. And if you have a large waist, more than 35 inches in women, more than 40 inches in men, it means that all of those combined make up metabolic syndrome. She's trying to say something there. Yeah. No. Anybody ever see that? You ever see that? Yeah. That's behind somebody's neck. All right? That is what we call acanthosis nigricans. Acanthosis nigricans. No, listen carefully. This does not mean this person did not scrub the skin well this morning. All right? Because you can scrub that from now till tomorrow next year, and it will not remove. This is a sign that the body is struggling to deal with sugar. Now, this person could be going to the doctor, doing all the blood tests, and everything comes back normal. Why? Because the organs in our body, the pancreas and other organs, this is saying that they are working overtime to ensure that things remain normal. All right, so you might go to the doctor and check up and thing, and everything is normal, and you think you're good, but you're not good. Once you're seeing this, it is a sign that the body is working overtime. The question then is, for how long can people work overtime? For how long can... So after a while, the body is going to collapse because we really can't keep going and going overtime like that. And so the point I'm trying to make here is that once we see this, it shouldn't be business as usual. Well, we shouldn't even wait for this to happen. All right? But it shouldn't be business as usual. Once we see this is a sign that the body is working overtime, and it means that you need to make some changes, which we will talk about as we go along. All right? Now, let's look at some symptoms of high blood sugar. All right? These are some symptoms that occur, and you will tell me if you can relate to them, right? Those of you who might have diabetes in the audience. All right? Going to the bathroom frequently, feeling thirsty, all right? Tired, blurred vision, burning and tingling in your feet. I can add another one there. Always hungry. And not only always hungry, but you want the sweet things. All right? You're craving for the sweet things. Let's look quickly at why these things happen. Why is it that we go to the bathroom frequently? No. We have all this excess sugar in the blood. Remember we said this sugar needs to go where? Where the sugar needs to go in order to make energy? Into the cells. But it can't get into the cells either because there's not enough keys or the keyhole is blocked up. No. We need to get, the sugar is now outside of the cell, in the blood, waiting to get into the cell. But the kidney realizes that, hey, this is too much sugar here, and it needs to get rid of some of the sugar. So the kidney is going to get rid of the sugar. And in trying to get rid of the sugar, you're going to wake up midnight, 3 times in the night, to go to the bathroom. Whole day you run into the bathroom, because the kidney is now trying to get rid of this excess sugar. The question is that a good thing or a bad thing? Somebody say a good thing? A good and bad? No, I'm going to tell you why it's not a good thing. No, before they make this, not artificial, this coconut where you just buy it in a packet, the powder in a packet. And before those days, we used to pick the coconut from the tree and grate it and squeeze. Oh, we still do. All right. I'm just checking to make sure. No. When you mix that coconut and you have to pour it into a strainer, and then what do you expect to come out of the strainer when you put it into the strainer? Only the milk, all right? Anything else other than the milk? Only the milk you expect to come out. What would you say about that strainer if you see husks passing through this and getting into the... Right. No, the kidney is like a strainer. There are certain things that must not pass the kidney. One of those things is sugar. So we just said that when we go into the bathroom frequently, it means that the kidney is getting rid of sugar. So if sugar is passing the kidney, what is really happening with the kidney? You're damaging basically the kidney is being damaged. And that is why people with diabetes, after a number of years, end up on dialysis and those kinds of things. So it is not a good thing. All right? Thirst. Why do we feel thirsty? All right, when we pass all this excess sugar, the kidney have to use water to get rid of it. And it's got to take the water from inside your system to get rid of the sugar. And so the body eventually gets dehydrated because the body don't have an unending supply of water inside it. All right, so that is why we feel thirsty. Why do we feel tired? All right, the sugar is not getting into the cells to make the energy that we need. And it's the same reason why we feel hungry. Now remember, the sugar must get into the cells to make the energy. So if the sugar is not getting into the cells is going to cry out for work. We need some raw material to do our construction here. All right? And so the brain interprets that as hunger. And so you start to feel hungry. The brain tells the stomach that to start making some noise because we need some sugar to get into the cells. Now, remember, what is it that the cells need to get? Sugar. And what sugar is? Sweet. And so when our blood sugar is high, the brain gets the information that we need something sweet. And so that is why you get this urge. You want a piece of cake or you want a piece of chocolate. All right? Because your blood sugar is high, it is not getting into the cells to make energy. So the cells think that there is no sugar around and it's calling for sugar. So that does not mean that you need to eat that cake. It doesn't mean that you need to eat that chocolate. What you need to do is to get the blood sugar control, get it down. Then blurred vision, burning and tingling is another. It comes from basically the same source. So what happens there? So we're talking about this excess sugar that is around our body, moving around the bloodstream. As it moves around the bloodstream, we have the small blood vessels that it encounters. When it reaches to these small blood vessels, the small blood vessel is unable to accommodate these large sugar molecules. So what do you think happens there? The sugar goes and it blocks up the entrance to these small blood vessels. So what we have there, a circulation problem starting there. All right? And so everything beyond that point is starved of oxygen, it's starved of the nutrients and so they're not able to function as effectively. Guess what? We have a lot of small blood vessels in our eyes. We have a lot of small blood vessels in the soles of our feet and the tips of our fingers. And so we're going to start feeling this tingling, burning in the fingers, in the toes, and the sole of the feet. You're going to start seeing blurred. All right? This is because the circulation supply to those areas is impeded because of the high blood sugar. So now, how are we going to go about, the question is, how are we going to go about doing what it takes to bring that blood sugar to where it should be to avoid all of these things that we talked about? Now, the first thing is, how can we know if our blood sugar is high, low, in between? How do we know that? We got a test. Wonderful. All right? So we need to test our blood sugar. And when we do the test, we get some numbers. All right? Isn't that so? Now, what do those numbers mean? So you get up this morning and take your blood sugar, and you get a number. What do those numbers mean? No, Your interpretation of that number is dependent on when you take the blood sugar. All right, it depends on when. So you get up this morning, before you eat anything, and you check your blood sugar, you want a number of less than 110. Everybody get that? What number we want? Less than 110. By the way, that is if you have diabetes. If you don't have diabetes, we want it to be less than 100. All right? If you don't have diabetes, the fasting blood sugar should be less than 100. If you have diabetes, we give you a little more bly, 110. Now, 2 hours after a meal, you want that blood sugar. If you check it 2 hours after a meal, it must be less than 140. It must be less than 140, whether you have diabetes or not. All right? Now, it means, therefore, that if when you get up in the morning, it's more than 110, all it means is that you have some work to do. If when you check it after 2 hours after a meal, it's more than 140, it means that you have some work to do, which we're going to talk about. All right? Now, it's also important to recognize that when you check your blood sugar in the morning or whenever, what is really happening is that you're getting an understanding of what your blood sugar is right now. It doesn't tell you what your blood sugar was last night. It doesn't say what it was last week. It's only telling you what it is right now. There is a test, however, that is done that can give you an idea of what your blood sugar, an average of what your blood sugar was for the past 3 months. And that test is the A1C test. All right? That test, however, is a little more expensive, and so it is not one that we would do freely. We have a limited amount of those tests here. Just in case you may want to check that, we can accommodate that for you, but that is at a cost. All right? But the A1C, the cost is $100. All right? And by the way, in the lab is the cheapest price I saw it for in the lab is $150. All right? I saw it for more than that as well. But that test gives you an idea of what your blood sugar was for the past 3 months. So you get a better understanding of how well you're managing your blood sugar. Now, when we do that test, if you have diabetes, you're looking for a number of 7% or less if you have diabetes. If you don't have diabetes, it should be less than 5.8. If you are more than 5.8 but less than 6.5, it means that you have what is known as pre-diabetes. And pre-diabetes is basically saying that you're on the borderline. You can fall over on any side, and more likely you fall over on the wrong side. All right? So that A1C test is what will give you that average of what your blood sugar is like. So there are 4 things that we can do to fix all of this, to help with managing our blood sugar. So anybody can tell me, what are those 4 things? 4 things that we can do to manage the blood sugar. Exercise, 1. 3 to go. All right, your diet, that's number 2. 2 more to go. Rest goes with exercise. So we still have 2. Testing only tells us where we are. Well, that's diet. We have 2 more still. Stress, all right. How you cope with stress? All right, 1 more to go. I hear somebody mentioning it there. Medication. All right? So those are the things that we need to work on if we're going to manage our blood sugar. So we need to look at our diet. And the thing is, there is no one size fits all for management of diabetes. So when we talk about diet, I can't just stay here and say, oh, make sure you eat 1 pound of sugar a year, or make sure you eat a spoon of rice, because what would be too much or too little for one person may be the opposite for another person. And so for each of these things, we need to have that one-on-one conversation where we can talk about what is happening with you individually, uniquely, and come up with a plan that is suitable for you. But generally speaking, in terms of diet, we want to focus on your whole grain foods, all right? Because the whole grain foods would have what is called fiber in them, and the fiber is what slows down the pace at which sugar enters the system. So the slower the sugar enters the system, the more the body is able to manage it. Now, quickly, if we have one slice of whole wheat bread and one slice of white bread, which one would have more sugar? The white bread have more sugar. What if I tell you they have the same amount of sugar? The same amount of sugar, all right? However, with the whole wheat bread, that sugar is entering the system at a slower pace. So not because they say sweet potato is good, you're going to eat plenty sweet potato. All right, I had a patient say to me that, oh, they say that oats is good, and whole day I eat oats, man. All right? No, not because we say that those things are better, it means that you need to eat more of it. They still have sugar. Remember we identified them earlier? All right, there's some of those that are better than others to use, but not because they are better, it means that we need to use a lot of them. We still need to portion it. And the portion is what we have to sit down and talk about individually. All right? Exercise. What is exercise? Walk, movement of your muscle. All right, because I was just going to ask, if I can't walk, can I exercise? Yes, you can sit down right in your chair and exercise. A lot of people try to make excuses. Oh, I had a back surgery. I had arthritis in my foot, so I can't exercise. Lie. They don't want to exercise. All right? Exercise is just doing whatever you can do to move your muscles to keep them active. So if you can run, run. If you can't run, please don't run. All right? Walk or sit down in a chair and move your hands, move your feet. All right? But do something for exercise. Half an hour, 5 days a week to the minimum. All right? Again, this is something that we're going to have to sit down and talk with you one-on-one about to make up a plan that is uniquely for you. Medication. No, I am the nurse in charge of the lifestyle clinic in Arima. I'm there close to 2 years now. And I have hardly had any patient, maybe about 5 in that 2 years, that would have come to me when I asked them to explain how you take your medication. About 5 of them so far would have been able to explain to me exactly how to take the medication. All right? So we find a lot of people go to the doctor prescribes medication for them, they're taking them religiously, but yet still cannot get control. Why? Because they're not taking it correctly. All right? And so that again is something that we need to understand. In terms of medication, just quickly, in terms of the tablets, most of the tablets for diabetes should be taken with your meals. So it means that while you're eating, you stop, take it, and then continue eating. All right? A lot of people take it before, they take it after, they take it all kinds of ways. So you should take it with your meals. The other thing is that 4 to 5 hours after taking that medication is when it will be working hardest. And so if you take it with your breakfast, 4 to 5 hours after will be what time? Lunchtime. But some of us, the lunchtime is 10 to 12 hours after the breakfast. All right? So when the medication is really working hard, it has nothing to work on. And when the medication starts to fade away, that is when we put anything into the system. All right? And so we miss the period when we can benefit from the medication. So again, we need to sit down and talk about the medication, how to take your medication. Then, stress. Whenever, especially with persons with diabetes, there's a lot of stress there was stress before diabetes, and then diabetes came and bring more stress, added stress. All right? And so there are times when you feel overwhelmed and you can't bother with all this tablet you have to be taking every day. You got to make sure you eat on time. And so stress can overcome us sometimes. The question is, how do we deal with having to deal with all of this stress? Any suggestions? How do we cope with all the stress that we have to deal with? So we want to talk about how you feel. All right? You want to talk about how you feel. You want to find a friend or a family that you can trust. All right? And we know that the best friend to have is Jesus. Oh, you sound like you're not sure. All right? The best friend to have is Jesus. And so, even if we don't have any friend to talk to, we have Jesus we can talk to. All right? Just talk about how you feel. I just don't feel like taking my tablets today, Lord. I don't feel like going out and exercise today, Lord. All right? Just talking about how you feel, it helps to relieve some of the stress that we encounter. All right? And of course, we don't want to leave out the option of talking with a friend, talking with a family member. And again, I like to know that people who don't have diabetes also are part of these sessions, because you can understand, you can be able to relate to persons who have diabetes and be that support to them when they're in these situations. The more support they get, the better they're able to manage the diabetes. All right? So, what happens next? Now that you have gotten all this information about diabetes, what it is not, how the risk factors, these are some options that I have available for you. All right? The first is a self-management course. You can have self-management consultation, a diabetes prevention course, and supplements. So, in terms of the self-management course, these are what you will get from this course. All right? You will learn how to eat, skills how to eat healthy. We talk about diet being one of the things that we need to work on. All right? You will learn how to get and keep active. All right? You'll learn how to monitor your blood glucose so that you will know how well you're managing. You'll also learn how to use the medication effectively. I was just talking about that. So that, because you might be taking the medication, how the doctor said to take it, but still not getting the control. And so this course will teach you how you can do that. You will learn how to solve problems associated with diabetes management. All right, and there are a lot of issues that will come up that in your management of diabetes that you need to make decisions about, but you don't know what to do. In this course, we can teach you how to do that. You will learn how to cope with the emotional issues. We were just talking about stress, managing with stress. And we teach you how to cope with those emotional issues associated with diabetes. Now, the course is of 12 weeks duration. It's once a week for 2 hours, for 12 weeks. All right? Now, it's important to understand that when it comes to management of diabetes or any chronic disease, it takes time. And so it makes no sense me saying, oh, we're going to do a 1 week course or a 2 weeks course, because it is something that we need to get gradually. It calls for some behavior change, and these things occur gradually. People don't just change behaviors. Well, people don't change behaviors overnight. It takes time to change behaviors. And so this course is going to be for 12 weeks duration, and we're going to be meeting once a week for 2 hours. In that period as well, we're going to be meeting one-on-one for at least twice. It could be more than 2 times, or at least twice during that session, so we can look at what is happening uniquely with you and a plan that is special for you. We need between 20 to 30 participants for us to really be effective with this course, for us to be cost effective, because it costs some to run a course like this, because we're going to talk about what you'll be getting. All right? But we need between 20 to 30 participants so that we will be able to cut down on some of the cost of the course. You will be getting a physical assessment at the beginning and at the end of the course. So in that physical assessment, a doctor will examine you. We will going to check your weight, your height, we'll check your BMI, we're going to check your HbA1c. We talked about the HbA1c, so that we have a baseline information that we can refer to. So after we take you through the program, we teach you these things and we work with you to make some behavior changes. At the end of the 12 weeks, we're going to do this thing all over again. We're going to do all these tests. We're going to do the physical examination. We're going to check your foot. We're going to take your HbA1c, give you a full checkup. And we are expecting that at the end of the 12 weeks, there would be some improvement. It means, therefore, that from then on, having learned things that you can do, we're hoping that you will continue along with that vein and help you to have some management of your blood sugar. At the end of the program, we give you a certificate of completion, right, that you can frame and keep for yourself. Now, then there's the self-management consultation. You may not want to, or you may not have the time to come for the course, but you can come to meet me individually. And in that self-management consultation, you have a chance to talk about your specific problem, and we can come up with a plan that is specially for you. And we are, in that session, well, not in this session, because this is going to have to take more than one session, because like I said, it's not a one-shot thing. It's a case where we sit down and we look at a plan. I give you a plan to work with. You go and you try out the plan. We come back and we look at the challenges that you have with implementing that plan, and we look at how we can circumvent those challenges, and we continue to communicate with each other, continuing until we can get to a point where we have some control. All right, so we assess your present status. We prioritize the needs that you have. All right, because there may be a number of things that we need to address if we're going to have some control of the blood sugar, but we need to prioritize it and then take them in bits. All right, so we prioritize those needs, create a plan that is customized for you, and then the mentorship continues until you're able to achieve the goals. We need to have at least 3 sessions of between 45 minutes to an hour. It may take more than that, but at least 3 sessions if we're going to have a good consultation. All right? Then there's a diabetes prevention program. The diabetes prevention program is mostly for those, it is for those who are at risk for developing diabetes, not for people who already have diabetes. All right? All right? It includes persons who are diagnosed with pre-diabetes. We talked about pre-diabetes earlier, where you're on this borderline, not knowing which side you're going to fall on. It is for persons who would have had gestational diabetes only during the pregnancy. It's for persons with metabolic syndrome. We talked about metabolic syndrome earlier. And persons with polycystic ovaries, persons with acanthosis nigricans. Everybody knows what is acanthosis nigricans now? Oh, you weren't here for the presentation? Right, so in the presentation we talk about acanthosis nigricans, the thing behind the neck. All right, right, so that is acanthosis nigricans. So this program is for persons with those things. All right? This program is a 1-year duration. Remember I said that when it comes to management of diabetes, it takes time. All right, and we need to take time in implementing these programs. All right, it's once a week for the first 6 months, and then once a month for the second 6 months. It is to prevent or delay diabetes. It's about making lasting lifestyle changes, lowering the risk of having a heart attack or a stroke. You may think that you have learned enough in the first 6 months and can skip the second half of the program, but all you'll be doing is cheating yourself. Making lifestyle changes is an ongoing process. Staying in the program for the full year is essential to help you to stick to new habits and avoid slipping back into old habits. All right? If you have not reached your goal in the first half of the program, your lifestyle coach and other group members can help you succeed in reaching those goals. Eligibility for this diabetes prevention program, you must be 18 years or older. You can be overweight with a body mass index of 24 or more. You must not have diabetes, whether type 1 or 2. All right, we don't want people with diabetes on this program. All right, the other program that we talked about before is for those with diabetes. All right, you must not be pregnant. All right, you can have a recent blood test that shows pre-diabetes. HbA1c between 5.7 and 6.4 is where pre-diabetes is. So if you do a HbA1c and it falls within that range, you are eligible for this program. A fasting blood glucose of between 100 and 125 is also within prediabetes, and that will qualify you. Or a 2-hour blood glucose of between 140 and 199. If you take the prediabetes risk test, which is a test that you can do online, and it says that it is high, you have a high risk, you also qualify. If a doctor diagnoses you with gestational diabetes, you also qualify. All right, then we talk about supplements. Now we know that we should have our nutrients from our food, but then when we look at the food that is available today, a lot of it is full of so much of chemicals, and so that by the time we cook out those chemicals, we lose all the nutrients in it. And so it becomes necessary for us to supplement, all right? And we have some supplements that are organically grown, are made from organically grown plants that we want to recommend to you. They're from scientific research. By the way, all the programs that I'm suggesting to you are programs that would have been scientifically proven to help people with diabetes. The one for persons with diabetes, the one for persons with pre-diabetes, they're all scientifically proven to help persons with diabetes. We have great testimonies of persons using these supplements. And then, if you care to, my wife is going to show some demonstrations of how some of these products are good for you. Now, I have come to the end of my presentation, but I have a little quiz for you, because I'm a teacher, and when teacher finished teaching, the teacher wants to know how well you would have learned, It's just the teacher in me. So here we go. Question number 1, true or false? Diabetes is caused by eating too much sweets and cookies, cakes, and sugar. Oh my, wow. Good class, man. All right, false. All right. Diabetes is due to a problem with insulin. Either your body doesn't make enough insulin or your body doesn't use insulin effectively. All right. Oh my. Question number 2. Diabetes is a problem with insulin. True or false? Oh. All right, so it's not a sugar problem. All right? Oh my. Right, I put that in the wrong place. So diabetes is an insulin problem, because we say that it's the insulin that needs to open the door to the cells, and if there's not enough insulin, or the insulin not working effectively, that is where the problem is. All right. Question number 3. The liver produces insulin. True or false? Oh man, this is a bright class, man. This is a bright class. All right? So that is false. Insulin is produced by the pancreas. Some symptoms of high blood sugar. Some symptoms of high blood sugar. Tiredness. Frequent urination. Thirst, yes, thirst. Hunger. All right. Tingling in the feet. All right. All right, so all those are signs of high blood sugar. The last question. List 4 things you can do to help manage your blood sugar. Exercise. Diet. Medication. How you manage stress. All right? So those are the 4 things that we can do to manage your blood sugar. I trust that you will have learned something from the presentation today.